1023, welcome back. June is Brain Health Awareness Month, and today we are highlighting a place helping countless individuals regain their functionality and improve their quality of life after a brain injury. Joining us from the Hospital for Special Care is Senior Vice President and Chief Medical Officer Dr. William Pesh, along with Senior Speech and Language Pathologist Anita Baltalian. Thank you so much for joining us.
Thank you.
Dr. Pesh, really important topic here. I know you do wonderful work. Tell us about the power of rehabilitation when it comes to a brain injury or a stroke, things like that.
I think, according to the World Health Organization, there's 2.4 billion individuals that have some type of living with a condition that require rehabilitation. What our medical rehab program and our model really serves individuals with complex medical needs. They're challenged from a speech, language, cognitive issues, ability to transfer, walk, and talk. So it's really a comprehensive, and they're afflicted by various disorders, a brain injury, stroke, and other illnesses and disorders that could affect not only the physical well-being, but brain health. And we really focus on more of a multidisciplinary team approach. We have specialists, we have physicians who specialize in rehabilitation, we have other physicians who are managing the medical issues in a whole host of disciplines: physical, occupational, speech and language pathologists, respiratory therapists. And we really try to develop an individualized treatment plan, and then we focus, again, not only on the physical well-being, but the cognitive impairments, the executive functioning, memory. For instance, in a patient that may be a complex Parkinson's patient. Well, Parkinson's, someone who is afflicted with Parkinson's maybe can't walk as well as they were able to do before, but also from a speech standpoint, they can't articulate, they can't vocalize, and there's also cognitive impairments. And that's where we utilize our strategies and our specialists, including neuropsychologists and speech and language, to really focus on strategies to not only, again, address their physical needs, but their cognitive needs. And that's where someone like Anita, who's our senior speech pathologist, comes in with strategies to help with that.
Right. Anita, let's talk a bit more about those strategies. I'm sure the goal, of course, right, is to get people back or as close to, where they were before the injury, the accident. So tell us about your approach.
So all of our speech therapists at Hospital for Special Care are trained in both Speak Out and also LSVT Loud. And those are both programs that will help people with Parkinson's retain and regain their vocal function after a diagnosis. We also offer that at the outpatient level as well. And once individuals complete their course of therapy with a trained therapist, they're then invited to participate in a weekly Speak Out speech program to help maintain those skills and gains that they learned while in therapy. And we also offer a monthly support group, Power Through Parkinson's, that's open to anybody in the community.
I think that's really powerful, and I know you also have something for caregivers as well.
Yes, we also offer a Powerful Tools for Caregiver course. It's 6 weeks, 1 hour a week, either virtually or at the hospital. And the purpose of the program is to provide caregivers with tools and support that they need in order for better self-care while helping their loved one navigate a medical diagnosis.
That's great to have that resource, because I'm sure, the road to recovery goes well beyond just being in the hospital, right? It's a long journey. So, Dr. Pesh, this Brain Health Awareness Month, what do you want viewers to know about brain health, brain injuries moving forward?
So most of the patients that come to us are devastated by these severe injuries or other types of disorders. And we aren't always, and often we're not able to get that patient to where they were before. But what we do is we maximize their independence. We find what they can do when we focus on that. And when they leave, we maximize their independence. We develop strategies to help them and their caregivers. And it's a continuum. We need to continue. These patients are living with this type of disease and disorder. And while they may never be cured of it, we can manage them so they can maintain their level of functioning within the community if possible.
Yeah, I'm sure that brings a lot of hope to people out there. You can certainly regain a whole lot of your strength thanks to you guys. Thank you very much for the info today. We have your website right there on screen, hfsc.org, if you would like to learn more.